Good evening to all. I'm happy to share my experiences on this very dreadful condition, diabetic neuropathy. What is diabetic neuropathy? Basically, it is the effect on the nerves due to long-standing diabetes. And there are several types of neuropathy and several symptoms. So the commonest symptom is sort of pins and needles feeling. Many patients will say that they are feeling like as if some pin and needle is piercing them, and sort of what we call as paresthesia. And these generally start in the lower limb and also spread to the upper limb in what we know as a glove and stocking type of pattern. Also, patients experience severe numbness and what they say loss of protective sensation. Because of this numbness, they don't know very painful stimuli, and they're walking barefoot, they can step on a thorn, etc. And this is probably the commonest symptom. Other symptoms is when it's causing problems like autonomic neuropathy, it will start causing some vomiting, chronic constipation, chronic diarrhea, and certain other arrhythmias in the heart. These are the more dangerous complications of autonomic neuropathy. So basically, you can have a peripheral neuropathy where the area which I told you, glove and stocking area of the feet and hands can be affected. It can have a proximal neuropathy. Single nerve can be affected, what we call mononeuritis, and also what we call as cardiac autonomic neuropathy, diabetic constipation, diabetic diarrhea, etc. Now, basically, the cause for this problem is due to high blood sugar. And it's basically less blood flow to the nerves, a type of ischemia, and formation of what is known as advanced glycation end products. And besides this, high cholesterol and high blood pressure, smoking, all these conditions can worsen this particular problem. So this can be very distressing at times, and many times patients and doctors don't know how to treat this condition. So how about managing this condition? First, you have to do a proper investigation. You can do nerve conduction velocity and simple diabetic nerve studies, like checking doing the monofilament test, and also doing a test like biothiometry, where you check the vibration sense and also the hot and cold temperature sensation. Then another test known as nerve conduction velocity can be done to assess the severity of neuropathy. Cardiac autonomic nervous system testing is also possible. Once all this is done, we have to manage the patient. The patient is managed by, of course, most important, controlling the sugar and controlling other risk factors like blood pressure, cholesterol, etc. And then we have some drugs. Common drugs which we use is methylcobalamin. We also use drugs like gabapentin. Also, we use drugs as pregabalin, amitriptyline. All these drugs basically to reduce the pain and symptoms of diabetes. And this requires team management along with the diabetologist, nutritionist, neurologist, and diabetic foot specialist. So these are what I wanted to talk about diabetic neuropathy.